Hello, everyone. To celebrate the breastfeeding week, which is usually in the first week of August, we have an esteemed gathering over here. To my left is Dr. Asha Dalal. She's the director of Gynaecology and Obstetrics and plays an integral part in mother and child health. To my right is Mehezabin Dordi. She is a clinical psychologist in the rehab services and a very, very experienced person as far as behavioral issues and how to deal with maternal anxiety. And I'm Rahul Verma. I'm the director of Pediatric Services, a neonatologist by profession. And we are all here today to discuss the wonders of human milk. So, Dr. Dalal, ma'am, would you like to initiate? What do you think from the mother's side of you? How do we prepare things and how do we culminate that immediately during or after birth?
So, what are the benefits of breastfeeding for the mother? Most of the time, women today come to ask us, do we need to prepare before birth? See, by and large, you don't need to prepare before birth except to see that you do not have any retracted nipples. Many women call us saying, oh, something is leaking. Should I go to the ER? It's normal for colostrum to be there during pregnancy. There's nothing you can do about it. It's good if you're getting it. Use a breast pad. Now comes the delivery. See, mothers are not born. Once a baby is born, it is not that automatically everything happens, but that first skin to skin, where it should be within the first hour. And when you put your baby to the breast, there are a lot of advantages. It is not just about bonding. It secretes a hormone called oxytocin, which is helping your uterus to contract. This goes on when you are breastfeeding. Naturally, normally, your breast will involute to the size that it is supposed to. The second great advantage is, I don't have to tell you, it is bonding. You know, more milk comes, the more you breastfeed. It is not breastfeeding only. If you even just hold your baby, you find that suddenly your milk production increases. Yes, it may decrease sometimes because of lack of sleep, overwork, but the best way of getting more milk is by holding your baby. The second great advantage is that while you're breastfeeding, you're not ovulating for a long period of time. So, actually, if you're exclusively breastfeeding, it's a very good contraceptive. I'm not saying that you should only rely on this, but by and large, it's very difficult or unlikely that you get pregnant in the first few months if you're exclusively breastfeeding. Yes, while you're breastfeeding, you're utilizing energy, so it does help in a little bit of weight loss also after birth. That does not mean that you can go on eating what you want and say, I'm breastfeeding, so now I will lose weight. You will not lose weight. It's just a startup. The rest entirely depends on your diet and your exercise. Coming to the other things. If you are long-term breastfeeding, they say that it will help in lowering your blood pressure. It prevents cancer of the ovary, of the breast for long-term breastfeeding. Also, it removes anxiety and postpartum depression in many women. You know, it's such a relief. It takes almost a month for you and your baby to get used to each other and to be really happy with all the experience of feeding and, you know, the whole mother baby experience. Let me tell you from a personal experience, my little grandson, fully exclusively breastfed till more than a year when I had to put an end to it, he goes on telling her, Mama, I love you the bestest. I don't want I will not say this to any other woman. And she always tells him, yes, beta, I'm going to record this, say this to your wife. So you see, that bond between the mom and a child, that is something which is unbelievable, and it is only to be experienced to know what it actually feels. There is such a lot of satisfaction that you get when you see your baby grinning and, you know, having a good feed when you are breastfeeding. And of course, the practical matters. It is anywhere. Anywhere, you don't have to make any preparations. It is always available. wherever you are in the world, you can feed. There is no place where there is a mother who can't breastfeed a child. And of course, it doesn't cost anything, it's there. So, all I would like to say is that breastfeeding has amazing advantages for you. But while you're breastfeeding, you must look after your diet, your proper nutrition, a little bit of exercise, and sleep. It is not a crime to pump milk and keep, because if you pump also, the lactation continues and your baby is getting the advantage of your feed. If you can't breastfeed, that's also not a problem. Talk to your pediatrician about what are the supplements that can qualify. It still does not stop you from bonding and holding your baby. Overall, the experience is really wonderful. Thank you.
Thank you very much for that elaborate answer. So, so far we've understood that human milk is the best for the baby from the time of birth, and we need to continue exclusive breastfeeding for at least 6 months, if not a bit longer. Uh, Physiologically, it plays wonders. We need to understand that human milk contains more than 3,000 elements as part and parcel of the constitution. Even the best of infant formula will have only around 150 to 200 components. So the benefits of human milk far surpass any other feed to a baby, especially in the first 6 months. The other thing we need to understand is very clearly it has been scientifically proven that breastfeeding, initiation and maintenance for the first few months actually reduces the infant mortality by more than 15%. And that's a very big number for a country like India, where mortality, because of the vast population itself, the absolute numbers are way high. So that is the other thing. Um I also believe that antenatal counseling, especially in mothers who are delivering for the first time, followed by post delivery counseling, brings about a very good outcome in the form of exclusive breastfeeding. Sadly, as of today, India, which used to exclusively breastfeed years ago, due to various reasons of so called industrial progress, the numbers have unfortunately percolated to slightly under 50%, and it doesn't continue for a very long time, especially since mothers are working mothers. They do get, most of the agencies, whether government or private sector, would give 6 months leave. But for whatever reason, if the leaves are not sufficient, as Dr. Dalal pointed out, storing human milk is a very good option. And there is a way of doing it. I'm sure every hospital where a baby is born will have its policy and can share it with the mother how to store milk. So overall, we have a great combination of very bioactive human milk, which confers not only nutrition, but also imparts a huge amount of immunity, which sadly cannot be replicated by any other milk or formula. So coming to that, Mehezabin, you must be facing mothers who are always a bit worried about initiating lactation, or more importantly, they must be thinking that there's a failure of lactation. So, how often and what advice would you impart to them to ensure that they are able to lactate successfully?
Right. Thank you for the question, sir. And I think it's very important for us to understand that though lactation is a very, very normal process, it may not always be easy. It may not always come very naturally for a lot of mothers, and that can create a huge range of emotional ups and downs in them. Right from the ideas of, oh, I failed my baby, oh, am I going to be a good mother? Am I going to be able to bond? So these are some of the concerns that come up very, very often in my therapy sessions. Of course, we are already aware that postpartum depression is something that's very, very seldom spoken of, and it's very, very prevalent in a country like India. The statistics say that 1 in 7 mothers experience some form of postpartum depression at some point in time, and lactation related problems tend to contribute greatly to these kind of things. Another very important component that a lot of mothers also share is that when they're experiencing that break right after pregnancy, if they're not working, they're spending time with their children, they also experience symptoms like, okay, People are expecting me to be happy. People are expecting me to smile, but I feel tired. I'm not sleeping well. My sleep schedule is all over the place. I am the default parent over here. So all the responsibility comes to me. So these are also some of the challenges that parents bring up. And like Dr. Dalal also mentioned, that these can contribute to lesser production of milk. So that becomes like a little bit of a cyclic process, that the mother's not getting enough rest. And because of that, the milk production is affected, and because of that the anxiety increases, and that becomes like a little bit of a process in which therapy does play a very, very important role, because the idea of counseling is to provide them with the safe space and to express things the way they feel without any form of judgment, without any form of social pressure. Another very important thing that I would like to add in this is we are seeing a huge number of uprise in geriatric pregnancies. For those who don't know, geriatric pregnancies are mothers who are conceiving above the age of 35. And there are various reasons for these things to happen. Some people prioritize their career, sometimes, life gets in the way. And that creates a whole gambit of issues where the mothers come in with fear for the safety of the child, fear for their own well-being, not being able to produce milk to the extent like, will I be able to live long enough for my child to go to college? Sure. So the idea is that there are a whole bunch of different emotional ups and downs that come in. And yes, pregnancy is a very, very joyous occasion, but the emotional landscape can be a little tricky to navigate. And that is where psychological help also comes in very, very handy for patients to be able to sustain themselves through the process. Because, of course, we realize that a healthy child is very important. Nutrition is very important, but so is a very healthy and a mentally fit mother for the child. So I think that is where the whole angle of psychological support comes into the picture.
So it's not only just the physics and the physiology, but there's also the mind over matter, which matters a lot. And I think a lot of family support is indicated for successful breastfeeding. And I think that's very well placed. Anything towards the end, ma'am, you'd like to add in?
I would just like that people believe that breastfeeding, leads to a lot of less problems in the baby, increases the mental ability. What is your take on this?
So the concept is actually very beautifully put, and it is actually uh, propagated by the infant milk formula um, companies, but it is completely and scientifically based that the first 1,000 days from the point of conception till roughly 2 years of age is where the brain development of the fetus and later on the newborn and the infant is maximal. So by the time you're 2 years old, roughly 95% of the brain is actually already physiologically well formed. So keeping that in mind, maternal nutrition becomes very important for us, and we ensure that she eats well and the right things. Physically, psychologically, she needs to be very well in a very good environment. And then, of course, after birth, we continue to feed various components of human milk. For example, besides the proteins and the calories, we also have DHA, we have omega fatty acids, we have micronutrients, we have bioactive factors. All of this combined to give rise to optimization of the fetus being converted into a newborn and later on to infancy. So not only physical development, but also neurodevelopmentally, it is now being very, very clearly understood that human milk is far superior to any other feed in this 1,000 days of life.